Right. Thank you everyone for joining us. We have foundation donors and LiveWell senior members here with us today. So if you don't know me, my name is Megan. I work in the foundation, and we're kind of doing a joint webinar today with Melissa. And today we're talking to Dr. Edmund Liu and Dr. Matt Liu, who are both family medicine physicians at Adventist Health Glendale. And they're one of the many physicians that have successfully transferred to telemedicine. So they're going to talk to us about that today. So I'll go ahead and give the floor to you guys.
Okay, great. All right, so let me see. I am unmuted, I believe. And
Yes.
well, it's good to be with you today. We've been looking forward to this program because we've something that was very foreign to us has become very common in our day, and that's telehealth. And so I thought that what I would do first is talk about how our office, in particular, responded to the pandemic and to the quarantine. And then we can talk about how we adapted to telehealth, some of the benefits of telehealth, and we do have some interesting stories to share. And then we can, if we have time, we can talk about how telehealth will be integrated into our future practice. So certainly interesting times. So we started hearing about reports of this novel virus originating in Wuhan, China in February of this year. With the uptick of confirmed cases and hospitals coming dangerously close to capacity, Governor Newsom ordered a statewide quarantine to start on Friday, March the 13th. I remember seeing patients that week. Some of the patients started calling the office and canceling their appointments, while others showed up not wearing masks and seemingly oblivious to the threat of this viral contagion that had spread to pandemic proportions. So during the first weeks of the quarantine, I felt like a boxer who had taken a hard right to the jaw and staggering just to kind of stay on our feet. We had frequent staff meetings, brainstorming sessions on how we could continue to reach out to our patients by telehealth, either by video call or by telephone. And so it really required a concerted effort by our providers as well as our staff. So then came the unprecedented announcement by CMS that telehealth calls would be paid for at the same rate as a medium-level office visit. The action kind of propelled telehealth to where it is now. So from an HR standpoint, actually half of our staff were furloughed to either part-time. My long-standing medical assistant of over 32 years actually decided to retire. And someone that we had brought in just recently in the back office was then terminated. So difficult times because how we see our office is that we are family, and so as the practice struggles, then all of our families struggle. And but anyways, together we dealt with those issues, and so during the first 2 months of telehealth, it was not really business as usual, and so we were seeing probably no more than 4 scheduled patients at a time, and revenue was down to probably less than 25% in that first month. In the ensuing months, it has only recovered to no more than probably about 65-75% of normal. and so with that background, I'll turn it over to Matt, who will talk to us about how we adapted to telehealth.
All right, thanks. I appreciate it. I'm Dr. Lou the Younger. It's nice to meet everybody. I'm just going to share some slides right now, just kind of how our office adapted. So here's just kind of a picture of all of our employees we have here. So what we did, obviously social distancing and masking and temperature checks and screening. The big thing was to get out was that, hey, we're open, because I feel like a lot of offices closed, people didn't know. So we really took to social media, and that mainly being emails. So we really got onto a weekly, email and an information platform to tell people, hey, we're open. If you need help with something, we're here for you. So this is one of the things, as you can see, so we are here for you, right? So we do remote check-ins, enhanced cleaning, patient screenings. We send out questions, make sure they have fevers, contact with positive COVIDs, certain symptoms that they would better deal with in regards to just an over the video encounter versus actually coming in. Social distancing, face masks, etc. So on the right hand side, you can kind of see there, it's our hallway. We have some footsteps there, some signs saying, hey, stop, please wait for you to check in. Once you do check in, if you look in the doorway, here's our office manager, Ariana. We have this device that's actually checks the temperature of your skin that we kind of screen people. So they walk in the door and you can see Ariana on the right hand side. They stand in front of a little control heat pad you can see there. And then you can see on the bottom with the computer, you can see that it is able to read the temperature of your skin. Now, obviously, we have another thermometer, a forehead thermometer, if this one's a little bit off, just to double check. But that's how we initially screen patients, then we take them straight back to their rooms. Our waiting room, we did block off seats to abide with that social distancing, as you can see on the left. Covered it with ribbon, and a lot of times, luckily, we've been able to kind of get people just straight back to the room without having anyone wait here. On the right-hand side, this is our checkout window. You can see, again, social distancing stickers on the bottom, which we've seen everywhere in grocery stores, etc. And everyone's masked, and we have a good covering there. So you can see our office here as well. Everyone's kind of social distancing as well. And so that's kind of the main things that we did in the office. Now, as well too, we have more staff. So we actually have a couple of staff staying at home and working from home remotely. So that's answering telephone calls, setting up appointments, confirming things. There's a lot of things that I think a lot of us have noticed, with work and stuff, there's a lot of stuff that you can be able to do at home. So, once CMS kind of gave us the green light, like, hey, we'll cover telehealth and telemedicine, then we started looking for platforms, right? So our initial platforms weren't HIPAA compliant. They were Facebook, right? So Zoom, so we had Zoom, Facebook, FaceTime through the phone. We called, we'd block our number and call people and FaceTime them if they had an iPhone. And then Skype as well. Now, again, not HIPAA compliant, but this served our purposes initially until more platforms were able to kind of boost up their telehealth, telemedicine resources. So initially this transitioned over to something called Doximity Dialer, is something that we use. It's really great. It's free for physicians. What it usually is we send people a text with their camera phone right before their appointment, and they click a link and they allow microphone and camera access, and then that's it. It links you to a video that's completely HIPAA compliant, which is really good, really simple. You just click a link, hit yes to allow that access, and then we're connected. All right, so we have been able to use that platform being HIPAA compliant, which is great. Another one we use is something called ZocDoc. I think more of this is kind of more reaching the more millennial, like my generation. So, you go online, you click, you set up an appointment, and it's through ZocDoc. It's just another platform. So you sign in, and then you can do a video screen through your phone or your computer as well. And again, that is HIPAA compliant as well. And luckily for us, the transition was pretty smooth. We were able to really manage things through teamwork. I think through both generations, my father's generation of his hard work, his business experience, and obviously his medical experience, right? And along with me, just being a millennial and our tech savviness, and we're all about technology, right? We were able to kind of combine our forces basically and be able to make this work. Now, in regards to benefits, just talk benefits briefly about telehealth, telemedicine. So patients, it's really the convenience. And you can get physician access from really anywhere, just on your phone, right? And you can do a quick visit at work. We've had many instances where people, they go to work and then they step out, they go into their car, go into a different room, log on their phone, and we have a quick 15-minute visit through that. So I think it's just very convenient. Apart from not having to drive anywhere, or anything of that sort. It's just very convenient. For providers, it's great for us. We're able to really safely serve the community and patients during this pandemic in a way that's really safe. We keep our patients feeling safe as well because they're at home. They don't need to go anywhere. And we found that we can take care of a lot of things through telehealth. And also the more benefit is more frequent check-ins. I know there's a lot of patients and people just either be disabilities, hard to get out, hard transportation to get to the office. It's enabled us to really follow up with them more thoroughly. So I really think it's added a great benefit for those patients. They feel more comfortable, like, hey, I can just call and do a FaceTime video with my provider and still get the care I need from home. And I think it's added to greater care and a better health for these patients that really don't come in very often. And then, also for providers, obviously we get our personal bathroom, personal office, right? Unlimited snacks for us, but also being around family more. And I think it's a little, in regards to physician well-being, we're just kind of at home a little bit. Just going to share with you briefly some slides of our offices that we have. So here, first you can see here, let's go here. So this is my father's office. You can see here, he's got his stress bear that he has there. But this is kind of his home office here, his laptop and everything. And this is kind of his wellness, his kind of home gym in his garage that he has made, which is kind of nice. You can kind of step out during lunchtime, eat lunch at home, kind of get an exercise in and then go back and see more patients. This is mine. You can see up in the top left, this is my desk that I use in a room. You can see down the bottom left, I do have twins. They're 2.5 and they are quite rambunctious and they know daddy's home. So they love to try to interrupt. So you can see here, I have to put a bottle of waters here and also one of their pack and plays in front of it to try to keep them out. But it's been a lot of fun. And then here is my little small gym that I was able to make in my garage and with my all little workout buddies and my kiddos. So I think physician well-being, it's been really good, just lunchtime, good break, get away from the office, and it kind of prevents a little physician burnout on our end. So, okay, I'm going to pass it back to my father. He's going to talk about maybe some limitations and trials in regards to telehealth.
Thanks a lot, Matt. Certainly, it seems like quite a while that we were totally sequestered at home, and that was really kind of nice time. It was like an extended vacation to a certain degree. Got to know my wife a little bit better, and sharing her. So I tell, so she shares her kitchen, and I get to share the garage with her. So. But I wanted to get to talking about some of the limitations. Once we returned back to the office, I found that even though probably about 25% of my day is telehealth, and I think for Dr. Matt, it's probably a little bit more like 75% telehealth with his practice. That there are still some limitations and trials with telehealth. Certainly after coming back on I think it was June the 1st, where we were starting to see patients here in the office, I think it was really quite a reunion for many of my patients and myself, as we were actually able to kind of reunite and really enjoy the company of, though distance by 6 feet across an exam room and masked, that there were still some benefits of picking up just subtle nuances of how they were feeling, how their days were going, discussing whatever aches and pains or concerns that they had. It just went a little bit smoother for me personally. Certainly, some of the other limitations is that with that older generation who may not be very tech savvy, either don't have access to video capabilities on their cell phone, and I've actually sat down usually at the end of a visit, and I'll explain that our following visit will be telehealth, and so I asked them to pull out their phone, and and I just did this the other day, and usually after visits, and I'll actually call them and then help them find where they get their text messages, and then for them to go ahead and click on that link that says that Dr. Liu is wanting to connect with you. Please allow microphone and camera, and then that basically connects us. So I usually have to do that a couple of times to kind of prepare them for that visit a month away. So sometimes there's Wi-Fi connections and instability that occur with phone calls or with those video chats, and so there are times that it gets interrupted by either a reverberation in the sound, or if the video freezes. So those are some of those technical difficulties that occur. Certainly here in the office, we can depend on getting a urinalysis, getting a swab of a throat to determine if, with a rapid strep test or a rapid flu test, we can rule out or rule in whether or not they have those illnesses. So being on telehealth, it really, as you'll see with some examples that will both Dr. Matt and I will talk about, this is like pioneer medicine. Where you really have to depend on taking a really good physical, looking for those nonverbal cues in a two-dimensional sphere that virtual life is, and to actually continue to deliver good medicine. But despite the trials and all the other issues that come about, I think that we've been able to handle telemedicine successfully and efficiently. Some people say, is it safe? Well, if it's a HIPAA compliant platform, then it usually can't be hacked into as easily. And certainly it works extremely well. From a convenience standpoint, especially for those elderly that are in assisted living facilities or even skilled nursing facilities, we can actually telehealth them and do so very, very efficiently. And it's a little easier actually waiting at home if I'm a little bit delayed. Or even have to kind of move them an hour back, than waiting here in the office for that hour. So let me see. With that, we have a couple of stories to share that might be of interest. So early on in the pandemic, in the quarantine, patients were really frightened about going to the emergency room or even being admitted to the hospital for fear of being exposed to COVID-19. So I remember that there was this fellow that actually had lost some of the sensation in his left arm, and so it was on the phone that we talked, and through video I was able to lead them through some maneuvers where he would go ahead and lift up his neck and turn it over to his left, and it would actually cause a tingling sensation in his left arm. So Consequently, I told him that it wasn't an emergency situation. He didn't have to go to urgent care or to an emergency room. I referred him to Dr. Scott Lee, who's a spine surgeon, so he has been taken care of there, and actually underwent spinal surgery. I don't think it was. I think we waited until the quarantine was over before he actually proceeded with that surgery. I had another woman that actually had angina for 3 days, and so I did tell her that, it's a lot safer for you to go to the emergency room where they are taking precautions for exposure to the virus, rather than sit home and suffer a heart attack. And so she eventually went to the emergency room. She did in fact have a bump in her cardiac enzymes, and was diagnosed as an acute myocardial infarction. She was then taken to the cath lab, and coronary angiogram revealed the area of stenosis, and she was stented. And lastly, there was one of the patients that called early on in the quarantine, who had a previous surgery, and so was at the higher risk of having a small bowel obstruction. So there he was, hadn't really eaten anything other than taking some sips of fluid for a couple of days, until that small bowel obstruction would resolve. Well, after observing him and just complying with him and saying, look, you might be safe enough, maybe this will open up, then it did not. So at that point, I sent him to the emergency room. In fact, it was confirmed that he had a small bowel obstruction, and so he was taken to surgery for a lysis of adhesions and a small bowel resection. So Matt, you're up.
Well, mine aren't as serious as those, luckily. So mine are just pretty basic. Recently I just had a woman, they were traveling up north in California, and they're in the LA Philharmonic. They were up just kind of driving the coast, and they had to come back for some practice. So they came back, and that morning, the wife, the spouse, she ended up having some urinary tract infection signs and symptoms. So it was funny because the husband was driving, and so she had the phone while they were in the car and looking up a pharmacy nearby that they could stop by. And basically I did a telehealth visit with them while they were in the car, driving in the car to a certain pharmacy that was close by. That was about 30 miles out from where they were. That's where the closest one was. So it was obviously very convenient. I was able to get her antibiotics for urinary tract infection symptoms, and that helped out. Another one, just really quickly, is kind of a funny one. So this guy, and with the whole COVID, he started to have COVID symptoms. Had a little get together before, so I'm pretty sure he had COVID symptoms, but I had a visit with him while he was standing in line at an urgent care to get tested for COVID. So he was standing there, and we were just talking about symptoms and management of symptoms and stuff like that while he was in line. Obviously not the most private place at all, but again, I think convenience is a big factor here. It's not interrupting. You don't have to take out an hour of your day to go to the office and get tested. And it's very quick and simple things. And again, we can take care of a lot of things over telehealth. So those were my couple of stories.
Great, thanks, Matt. And so those are some of our stories. And telehealth is here to stay. We're not going to be able to put that toothpaste back into the tube. And so I know that there's talk at CMS that they may alter payment. They may do away with telehealth altogether. I don't think they're quite unwise to do that. But I think it is here to stay. I think if patients are screened properly, it can be done, performed safely, and be a great convenience. And also, we would actually have access to those patients who normally would not be mobile enough to either get to our offices or to the hospital or even to an urgent care. So with that, let's let's go ahead and we open it up to any questions that you might have.
So we have one question in the chat, and it says, are doctors finding it difficult for seniors who are homebound to log in correctly?
To log in?
Yeah. Mm-hmm.
Okay. Yes, most definitely. If we can have a little hands-on and prepare them somehow, I've successfully talked them through that process, but it does definitely take time, and so it's not but that's one of the reasons why why we've actually had to build up some of our staff in telehealth, because there's so much preparation time, even after a visit, in order to schedule another visit, to order laboratory tests or imaging. Then it's really our office staff that actually has to call the patient back and make that all happen.
Then we had another question in the chat from Carol. What about people who do not have a smartphone and do not have a camera on their PC?
I think I can take that one. That's going to end up being a house call or just a phone call. We've had to resort to just the phone, and we do the best that we can. And so we pretty much have to kind of triage what we can handle on the phone, what would be best done by video chat, or what would be best done here in the office.
Yeah, and to go along with that, I think a lot of times with my patients, those who don't have that capability, I know there's a possibility they have a grandchild or a son or a daughter who's close by. A lot of times they kind of accompany them and they help them with those things and use their own phone. We've had that happen a lot. But if there's no capabilities, if it's like a rash or something, we have them take pictures, we have them email it to us or text it through like a texting app we have. Obviously, we don't have their names or anything associated with it. And we can kind of take a look at that and talk to them over the phone.
So we have a couple more questions, and then I think Irene would like to say something at the end. So I'll just read these. They were sent to me in the chat. Bob would like to know a little bit more about the fees associated with telehealth visits.
So gladly, CMS did say that we would actually be paid for at a mid-level visit. And so depending on that patient's insurance, if they're a Medicare, Medi-Cal patient, or a Medicare and a supplement, or Medicare fee-for-service, they really wouldn't see any difference in that, in how that is billed. It's just a different type of service.
And then finally, Anne would like either you or Dr. Matt to explain your new portal.
Matt, you've got it.
All right. So our patient portal, so what we have is, it's not really old. We just really haven't used it very much in the past. So now, the times have changed, and we like the portal because patients will have access to their labs that they do and imaging as well. And they can also send us a note through the portal as well. So on the back side of things, going through the portal and asking any questions or things of that sort, it makes it a little easier on the back office. It kind of gets to us a little bit quicker than through emails or calling the office, which, we can get backlogged with a lot of people calling the office. So I think it's more of the patient experience of being able to have access to their health records, their, the medications, making sure all the histories that we have in there are correct, and they can add, certain allergies, add medications that they're on, and really kind of play an integral part in this electronic health record that us physicians have.
They even have access, right? The lab results is one of those common calls that with our receptionists, they're answering really common things like refills on medications, and as well as their lab results, etc. Then they would actually be able to do that all on the patient portal on their own. Granted, I think that there is, we can go a little way, we can certainly improve on the patient friendliness of that portal, but hopefully there will be some upgrades in the near future.
Thank you. Okay, Irene, would you like to?
Yes, thank you very much. For those of you who don't know me, my name is Irene Bourdon, and I'm president of the Adventist Health Glendale Foundation. And I know we've got several board members and also some affiliates and colleagues on the call with us as well. I couldn't help but take this opportunity to talk about some of the things that are happening at the foundation and specifically with our Live Well Senior program. You know, sometimes big changes come because we internally want to do them. It's just something that we want to do. Other times change happens to us and we just have to respond. And I really feel that the environment right now with technology and telemedicine, the change that took place with COVID just sort of forced a whole new environment. And so now we're all kind of, as Dr. Liu said, the toothpaste is out of the toothpaste, the genie's out of the bottle, you can't bring it back in. And I believe very strongly that this is going to be our future. So we in the foundation, and we worked with Melissa Veravetta, who many of you know. She is the manager of our Live Well Senior program. And we recently received a grant, thanks to our grant writer, Brian Gauthier. We received a grant from the Gunther Foundation to expand and convert and transform our Live Well Senior program, which was the traditional model of everyone coming together in groups, getting in their cars, driving over, finding parking, getting together in large groups and having classes and programs. We're now, because of COVID, because of the special vulnerability that our seniors have, we now are looking to convert a lot of our programming to the remote programming. And so it's validating for us to hear from Dr. Liu that, you know, we suspected that while this is something that is, you know, our reality for our patients today, that many seniors are struggling with, okay, now I have to figure out how to do this Zoom webinar. I have to figure out how to do this with technology. And we've had a feeling that that was sort of falling on the shoulders of our doctors, that was where a lot of the learning and the teaching was taking place. So our program is really built around training our seniors and our Live Well Senior members in particular on the logistics of how to use that technology to help them transition to telemedicine so that their time with their doctor could be spent productively, talking about their healthcare, talking about their condition, answering their questions, not trying to figure out how to log on to Zoom and other platforms. So I'm really pleased with that. I'm going to let Melissa talk a little bit about the programming that we've got in place, but I will say that right now she's focusing on direct support, training. We're going to have a person in the moment right there for people to access by telephone, to walk them through steps if they need to. We're going to try and we're going to organize super users. So we'll have seniors who know how to use the technology, who can volunteer to help other seniors learn this technology. And to your point, Dr. Liu, we recognize that there are special needs for the nursing homes and the senior community centers. So at some point, we will be expanding the services to those areas so that the seniors and vulnerable and special needs will be able to access this information, this training. So I'm going to hand it over to Melissa to talk a little bit about some of the things she's recently done for Live Well.
Hi. Yeah, we've had a really interesting adjustment with our senior program. Starting in March, we went from a full schedule, as many of you on here know, 200 every month for lunch and outside exercise every day. And then boom, it all stopped pretty much March 11th for us. And we have, thank you, Irene, and everybody else who has helped me and the Live Well Senior Program get on board with our new normal. It's hard for me too. I just want everyone to realize that this is not any easier for me than it is for any of you who are learning how to do all this new technology. And I do appreciate those of you who are new to this, and for those of you who this is their first webinar, congratulations and welcome. I'm super excited to see everybody. I love this actually, and if you want to turn your camera on, you can, so you can all see each other. And I also want you to know there are several pages. So there's a little, if you hover over the right-hand side of your screen, there's an arrow that goes to the right. And you can scroll through and either see names or photos, depending on who has decided that they want to turn their camera on. So that's one thing. So really, Irene, where we're at right now is we're learning little by little how to do the little nuances of these group webinars, and learning how to see each other, we're just learning how to do this, because this will help down the road with anybody trying to do a telehealth call with their doctor, seeing family. It's a social and it's an actual human benefit, if you will. I mean, it's not just about webinars. We're trying to really reach out to our community, and the week after next, we're going to be offering some exercise classes through Zoom. That will be also new. We'll be having a chair yoga every week and a balance fit class. So I'm super excited about that.
I am too.
Yeah, I know. So, I think people are doing pretty well. And Irene said, she's right. We are working on getting some people on board with tech support that can help those who are not getting it as easily as those of you who are here with us today. So, yeah, stay tuned. There's a lot coming down the pike in this program, and it's just my pleasure to be in charge of it at this time. Thank you.
So one other question for the doctors. One of the unintended consequences of COVID is all the doctors' volume has gone down. I mean, we've had many physicians say that they've lost as many as 40 or 50% of their patients. So I know that it was, your particular practice was very popular, and a lot of people, I think, were on waiting lists to get into, to be a new patient. Are you open, are you accepting new patients at this time?
Absolutely. I don't think that, at no time over the last 32 years, have we ever closed our practice. And so what we have done is that we've added nurse practitioners that are excellent, and basically Matt coming on is just a dream come true. And so we continue to welcome patients. I don't know of other practices that are quite as integrated as we are. We actually see patients in the acute hospital, as well as in nursing homes, assisted livings, and even do house calls if necessary.
Thank you.
Okay, so Dr. Matt, other Dr. Lou, older Lou. If you guys have anything you want to say to wrap things up, you can do. We're just in interest of everyone's time. I think we're going to end now, but do you have any closing remarks?
Thank you so much. It's just wonderful to see the two generations of Dr. Edmund Liu and Dr. Matt Liu continue to serve the community. Both of you are beloved doctors in our community. So it's really great to know that you've adjusted and you've pivoted as quickly as you have, because I know that you're meeting an important need in our community. So thank you so much for everything you do.
Thank you, Irene. Appreciate your work with the foundation, and certainly we are 100% supportive of your work, and we appreciate the support that the hospital has shown to our practice, and so we look forward to it. Even during difficult times, we will look back. We'll overcome these difficulties, and we will come out the better for it.
All right. Well, thank you so much. Thank you for joining us. This webinar was recorded, so it'll be up on our Adventist Health Glendale donor site, and maybe Melissa might send it out to the seniors. But yeah, we thank you everyone for joining. I hope everyone has a good week.
Get your
Thank
flu
you
shot.
guys.
Goodbye,
Thank you,
all.
doctors.
It's really good to see you all.